Hey, welcome back for another episode of the podcast, Porn Brain Rewire, with me, Dr. Trish Leigh. I'm so glad you're here today because we are continuing the discussion of erectile dysfunction that I've been talking about a little bit because it's the number one question that I get all the time these days. So I'm doing a deep dive so that I can help you. And then I've added a new module to my 90-day complete essential guide program on erectile dysfunction and how to heal your brain. So I'm here for you. I'm trying to give you what you need to not only heal your brain, but to be able to get back on track in your life. Now, you'll notice that this podcast is named the 3 quote unquote cures for erectile dysfunction. And most times when people see the word cure, they think of snake oil or voodoo or quack doctors. But I'm here to tell you there's no cure. What cure means to me is healing. And there are 3 different levels of healing that need to happen. So in essence, they are the 3 cures. And we're going to dig into them. Primary, secondary, and tertiary. Level 1, 2, and 3. And that's what we're going to dig into today. But you will not be surprised that when we get to the end of this podcast, there's really only one underlying issue. And this is my goal for you, is to connect the dots where other doctors, other therapists, practitioners don't. And that is something that is really important to me, and it always has been, is that there's a lot of science out there, but there might not be a study that connects all these different scientific studies back to one. I'm going to do that today for you in these 3 levels so you can understand what's going on. Now, before we dig in, I want you to know that if you are struggling or suffering with and from erectile dysfunction, you don't have to suffer alone, because I have a 90-day complete essential guide program, and I also offer brain assessments and professional neurofeedback coaching where I can personally help you. So if you have tried to get over erectile dysfunction and you still have problems, there is a solution. You just might not be able to do it alone. Many people can't. So please go over to my website, drtrishleigh.com, so you can check out those programs, because you know how I talk about this stuff, and it's totally true. It goes back to neuroscience, is that either you're in a downward spiral or an upward spiral. There's no such thing as a horizontal spiral. So if you have erectile dysfunction or the beginnings of it, it can only get worse unless you do something new to heal it. So let's dig into the quote unquote cures so we can get you moving in the right direction. I wanted to start with the tertiary today, but I've decided, instead of moving backwards, because I know sometimes it gets confusing, that first what we're going to do is start with function, erectile function, because we are going to dive into the 3 levels of erectile dysfunction. So for there to be dysfunction, it has to be functioning that's gone awry. And this is a very involved, complex series of systems that work together to achieve an erection when it is time to be sexual. Now, that's all loaded. That statement's all loaded for people who struggle with porn addiction, because the whole system, many systems, are dysfunctional when it comes to achieving erections at the time you're supposed to, and not having erections at times you're not supposed to. That's why we have to talk about erectile function, and we also have to talk about the dysfunction at these levels. So, function, before I get off on tangents, what are we talking about when we talk about function? So, get your journal out, and in it, whether you're a good drawer or not, it's probably, if you're like me, it might look like trash, but it doesn't matter. It has to make sense to you. Draw yourself a brain. Mine always kind of looks like a weird flat tire with a stem on it, but it's perfect. I know exactly what it is. Draw yourself a brain in the middle of your page, because we know from the science that there are primarily 2 causes for erectile dysfunction. One is psychological, and you can put an arrow to one side, psychological. The other is physical. Now, we know that from science, and there's been kind of a flip-flop back and forth. Which one is the primary issue, the psychological issue or the physical issue? And depending upon the science that you look up, it might say, yeah, we used to think psychological issues were at the core of erectile dysfunction. Now we think physical issues. But I want you to follow the cookie crumbs from physical and mental and follow them back to the brain with me, because what I know from my years of research is that a physical cause and a mental or psychological cause are in fact the same. And those arrows that go back to the brain mean that both the physical and psychological causes of erectile dysfunction are in fact neurological. So write that above the brain, neurological. The core dysfunction, the primary dysfunction when it comes to erectile dysfunction, is neurological at the level of the brain, because the primary thing, the primary organ that creates an erection is your brain. So this is the way that it works. From your brain is exposed to stimuli that makes you feel sexual. There's sexual stimuli that begins the cascade of arousal. And now here we're at erectile function. So the physical stimuli may be visual, it may be olfactory or smell, it may be tactile, you brush up against somebody, it may be fantasy or imaginative, which is very problematic in porn addiction recovery. But there's a stimuli that changes the way that your brain is performing. This is function still, we're at function. So if you are getting ready to be with your partner and both of you and your partner are undressing, then this is the stimuli that begins the arousal phase of erectile function in a healthy manner. So we have the stimuli, and what it does is it sets off the cascade of changes in your system. It starts with your brain. So if your brain is healthy and it's using the optimal brain pattern, the green zone means that when it's time to be sexual, your brain will respond to the sexual stimuli in a healthy way. Then from there will be changes in your system that release different hormones, different transmitters, neurotransmitters like dopamine. Dopamine's the pleasure transmitter. If you're in a sexual experience with your partner, it will release serotonin for happiness. It'll release oxytocin for connection. And there will be a cascade effect of your sympathetic and parasympathetic nervous systems. That is something that's called the autonomic nervous system, where these changes will happen automatically. You don't control them. They are happening from your brain down your spinal cord through your peripheral nervous system, the nerves that then innervate your penis and your reproductive sexual organs and go from unaroused to aroused. The way that it happens is that the nerves will send the message that there's sexual stimuli happening from your brain. The nerves will send the message down, and it will create changes in blood flow and in the smooth muscles of your penis to create and sustain an erection. And then throughout a healthy sexual experience with your partner, there are healthy levels of those neurotransmitters that are being transmitted, dopamine, serotonin, and oxytocin, plus hormones like testosterone. There will also be a reduction in cortisol, the stress hormone, so that now you can enjoy the experience with your partner in a stress-free manner. And through healthy sexual arousal, which we won't go into here, you can achieve, sustain, and enjoy the sexual experience through orgasm, which then that signals the change in the system that goes back to the state, the baseline state that you were in before the sexual experience. So basically, that's erectile function. Comes from the brain, down the spinal cord, through the peripheral nerves. It increases in the vascular system, blood flow, which then also stimulates the smooth muscles in your penis, and we have arousal and we have interaction. Now, that's erectile function. What happens in erectile dysfunction? There are changes at the brain level in multiple ways, which then changes the way that those neurotransmitters and hormones are released, which changes the way that the nerves flow through the peripheral nervous system, and there's decreased blood flow and decreased stimulation in terms of the smooth muscles being able to be activated and then to decrease their activation. Sorry, spaced on the right word to use there. So let's dig in. Primary level of erectile dysfunction. Now that we have function kind of covered. The primary level is clearly at the brain. Now, in your journal where you drew your brain, I want you to think about this. What activates your finger? Your finger doesn't activate your finger. Your brain activates your finger in the same way. There's what are called efferent and afferent neural pathways. So basically there's pathways from your brain to your body that if you have pain in your foot, it's your brain that is sensing that through the signals that are sent to from your foot to your brain. The same thing happens in your penis. These signals are going back and forth from your brain to your body. But if your brain is stuck in the pendulum effect, like we know that it can be if you are caught in a porn cycle, now your brain's not in that optimal green zone. Instead, it's using energy that's too fast and too slow. Too fast energy is that of stress and anxiety, and it's high alert. So if you're on high alert, your brain needs to be calmed down. On the other side of the pendulum effect, your brain is running too slow. It needs to be stimulated. But basically, your brain is running out in the extremes. When your brain's running out in the extremes, it can be caught in something that is called autonomic nervous system dysfunction, ANS dysfunction. So ANS dysfunction then leads to changes in the way that the neural pathways are activated. You're not in the green zone, so you can't be aroused in a healthy way. Now, it goes back to porn, and the analogy that I like to use is that if you've used your brain in this pendulum effect for a long time, what happens is it may have been in the pendulum effect before porn exposure, but we know porn exposure really locks in the neural pathways for this pendulum effect, making it so that your brain wants to go back into the screen for calming and stimulation. And it wants to go back to porn and masturbation for level 15 arousal. And I made that term up, but you get the point that when you're with your partner and you're having the most exciting sexual experience you could possibly have with a partner in the real world with a real human being who is interested in doing healthy sexual acts, this is a level 10 at its best, right? And I would argue most people are trying their darndest to be a level 10, but we all might be at level 7 or 8 at best, right? Because life's a busy life. I covered that in the Monday motivation. The world's a crazy place that leads to stress. It can be very difficult just in the first place if you have a green zone brain. It can be very difficult to find the time, the space, and the energy to let your system come down enough to fully enjoy a sexual experience with your partner. But I digress. Getting back to the point is that if you're in this pendulum effect, now your brain is in this heightened state. It needs level 15 arousal for calming and stimulation. And if you've been giving it that for a really long time, now it's time to be with a partner, and you can't achieve the same level of arousal because the midbrain has been desensitized. That is a word, desensitization. That's what happens to the cells in the areas of the brain. They can't get aroused with your partner because they're burnt out from all of that hyper arousal at level 15 from porn and masturbation. Porn is more mental sexual stimuli, back to our erectile function. Porn, imaginative fantasy level 15 sexual stimuli. Masturbation is a level, we'll just call it a level 10 to 12. It has stronger physical stimulation than having sex with your partner. So you've taught your brain to need level 12 to 15, and in some people, level 20, 25 stimulation to be aroused. Now it's time to be with your partner, and you can't get there because your partner is a level 8 trying her darndest to be sexual and to get that sexual stimuli going for you and for herself. So it changes the cascade. And the pendulum effect in the first place changes everything. Your brain is not in the green zone for optimal arousal. It's stuck in the extremes for suboptimal arousal. It's a suboptimal brain pattern, which means you cannot possibly be aroused in the same way as if you were using the optimal brain pattern. Hopefully you're still with me. So then what happens is it changes the flow of, you need more dopamine, there's less serotonin, there's less oxytocin for connection, because now your brain is hyper focused on trying to get as much dopamine to get you to level 15. So what that does is, we know that autonomic nervous system dysfunction can change the way that your cells function at the molecular level. There's scientific studies that show this. And there's scientific studies that show there's molecular changes at the cell level for erectile dysfunction. What there's not is a bridge connecting those two studies together. I'm here to be the bridge for you, to let you know that your brain, in fact, is stuck in autonomic nervous system dysfunction from the neurotoxin porn. And it is changing not only the way that your brain performs, but the way that the parasympathetic and sympathetic nervous system function as branches of the autonomic nervous system. It's changing the efferent and afferent pathways from your brain to your body, and it's changing the cell response. So it's decreasing blood flow and it's decreasing innervation of your penis to change the smooth muscles. This is a brain problem, not a penis problem. Hopefully you're understanding by connecting the dots. So this is the primary level. So the primary problem is a brain problem, first and foremost, from hypersexual stimulation from porn and masturbation. Are you with me? Secondarily, because of that, it's changed the cascade of the way that your nervous system and your body function, which is going to lead us to the secondary and the tertiary levels. Okay? I hope you're with me on this. So let's go to the secondary level. The secondary level is at the cellular level. There's something called nitric oxide, and that's the primary thing I'm going to focus on. Nitric oxide and calcium are the two elements that are involved in the regional area when we talk about cells. And there's dysfunction in both of them, making it so that arousal doesn't happen and bringing the brain and the body back down from activation doesn't happen well. So what happens is, then now when it's time to be with your partner, this brain problem creates the body problem at the cell level. So it's nitric oxide and calcium. When you take erectile dysfunction pills, what they're doing, the little blue pill, what they're doing is basically keeping your brain from shutting off the arousal system at that more local level. But that's a Band-Aid. That doesn't fix or doesn't cure, and it doesn't heal that primary problem that's happening at the brain. Clearly, it's a Band-Aid. So part of the solution is also helping the cells function better at the cellular level by improving the use of nitric oxide and calcium. So that doesn't mean go throw a lot of nitric oxide into your system, because what you have to do to heal is to be able to change the way your system is functioning, the dysfunction, and get it back to function so your system is producing the precursors for nitric oxide and is allowing the nitric oxide production in and of itself so that you can achieve erections by yourself. So that's the secondary level, nitric oxide, calcium at the cellular level, not only throughout the system, but also as it impacts penile erection and blood flow and muscle innervation. Hopefully you're with me. Okay, so then now at the tertiary level, let's go back to the idea of psychological and physical. We know that a physical problem and a psychological problem, when it's brain-based, which is most of the time, are both neurological problems. And I want to connect those dots and go back to arousal for a minute or two here. So the tertiary issue, which I've already alluded to, and the brain issue is arousal. Now, the idea of arousal has been completely changed if you've been watching porn for a long time. The lines between reality and fantasy can get blurred for so many people. If you've been watching porn and the scripts of porn, what you think should happen in a sexual experience is not at all what happens in healthy sexual experiences. So your brain's been trained in the wrong direction, like a puppy, to expect all of those experiences for arousal. So now you're with your partner who's interested in healthy sexual experiences, and it doesn't fit the script at all also. So that script in terms of arousal is what creates the psychological and the physical issues, because the arousal template has been changed. And I've been thinking about this a lot lately in people I've been talking with, is that the script of porn is really distorting to the mind. The mind is another parameter of, we already said it, mental, is another parameter of brain function. So your body and your mind are both controlled by your brain, and they both lead backwards to your brain function. So if you're watching these distorted scripts, this is how your brain function, part of it, beyond dopamine, this is how your brain function changes in the first place. But learning what healthy sexuality is so important, and it's not going to be an overnight phenomena. It's going to be teaching yourself to enjoy healthy sexuality, which could be difficult if you've been watching unhealthy sexuality for a really long time, and especially if the frequency and the consistency of porn use was there, and if you've ramped up the intensity. Intensity, I would say, is probably one of the biggest markers, because you've crossed over into different genres that have become violent or have become a three-ring circus of arousal. And if you're used to these super high levels of arousal, then it can be difficult to get back to that level 8 of your partner. And your partner's probably disgruntled if she has some sense any of this is going on. So ultimately, she might not even be interested. She might be a hard 4 right now. And you can see where the repair is. The repair is being able to practice healthy sexuality. I know you don't want to hear this, so stay with me. Practice healthy sexuality with your partner and create a new arousal template. And when that imaginative and fantasy sexual stimuli comes into your brain, you have to push it far, far away so it doesn't fire up the old neural pathways of level 15 arousal. You have to teach your brain to enjoy, get your partner on board so that the two of you are enjoying level 8 to 10 healthy sexual experiences together. Don't worry, I'm going to tell you some solutions in just a second, but I wanted you to understand the primary, secondary, and tertiary levels that you're dealing with here. Then we'll get to the solution. So, primary level is your brain function is changed, whether you believe it or not. If you want to know for sure, you should sign up for an assessment with me. It's on my website under QEEG Brain Map. It'll say under personal neuro coaching, it says QEEG Brain Map and brain assessment, brain rewire assessment. I have looked at so many brains that have been impacted by compulsive hypersexual behavior disorder. That's what this is called. And there's a few parameters that honestly I thought today, I bet not many other people in the world know about these parameters being off the charts with brains that have been impacted by porn use. And there's 2 primary parameters that show that your brain has been flooded out by dopamine, and that dopamine drowning, that dopamine deluge that leads to the dopamine drown out. I see that. I see that in brains that haven't watched porn in a year. And so if you're struggling with erectile dysfunction and it's a year after you've watched porn, I can show you in your brain performance pattern that you might have stopped watching porn, but you haven't unwired the porn brain pattern and you haven't remotely rewired it back to the optimal pattern. All of my work is quantitative. It's measurable by EEG, electroencephalogram. I can see how your brain performs. I show you it. And with your own eyes, you can see that your brain is flooded out with dopamine still. And if your brain's flooded out with dopamine, it's still in this pendulum effect. And then it can't be in the optimal zone of arousal. So there's no wonder that you can't get there. So that's number one, is that if you have a dysfunctional brain pattern, there's no way you'll be able to fix your erectile dysfunction without going to the primary first level problem, brain performance pattern that's flooded with dopamine and still in the pendulum effect. Number two is that changes all the cascades to the cellular level, and we're dealing with nitric oxide and we're dealing with calcium. I have been collaborating with a company that's created an awesome supplement. And when people work with me, I have to get my affiliate link going and all of that. But when people work with me, I hook you up with this supplement that can help your brain at the secondary level to get the nitric oxide and calcium operating like it should to help the cause at the secondary level while we are healing the primary level. So if you just work on nitric oxide in the secondary level and you go and you look up a nitric oxide supplement, it's not going to get you where you need to go because it's the level 2 problem. So it's like if you want to lose weight and get super fit, you have to work out and eat better. That's the primary solution for the primary problem. You can't just start taking supplements because supplements are the secondary level. Don't get me wrong, I take a truckload of supplements because we need them in today's day and age. We know food doesn't have at all the nutrition it used to 50 years ago. So supplements are a beautiful idea, but it's the secondary issue. The primary issue in weight loss is food intake and exercise. The primary issue in erectile dysfunction is ANS dysfunction, pendulum brain, plus the flooded from porn and masturbation. Primary issue has to be addressed for solution. Getting to the tertiary issue of arousal, and that's the stimuli that comes in, is that if you're still consuming porn and masturbating, if you're still fantasizing, if you're still lusting, lust itself, if you see a person and you check them out and you get dopamine hits, lust itself is going to keep firing up those old neural pathways that will make it difficult for you to be aroused in a healthy sexual situation with your partner. So we need to leave lusting behind. We need to leave fantasy behind. I've made 2 videos on this channel. Look up fantasy. There's 2 solution videos on this channel. If you're listening to the podcast, please go over to my channel on YouTube, Dr. Trish Leigh, Porn Brain Rewire. There's over 500 videos for you there, but 2 of them are on how to stop fantasizing because it's very, very, very important. Arousal, and practice healthy arousal with your honey. And guess what this starts with? I know what you're thinking, saucy acts and getting some role play going. No, but that might help. What this starts with is communication. Learn to talk to your partner. I know it's terrifying. I know it's not easy. Sometimes talking to the hub still terrifies me, but I put my big girl pants on and I approach and engage. Those are therapeutic strategies. Approach and engage is the opposite of what a person does when they go into a porn. Porn is escape and ignore and fly away. Approach and engage is, I'm feeling like I'd like to have better sexual experiences with my partner. Now I need to go talk with her and tell her what I enjoy. Ask her what she enjoys. But the caveat is, remember, a lot of what you enjoy is unhealthy right now, level 15. So you have to figure out how to take what is exciting for you and bring it back to a level 8 to get started. And it's not going to excite you in the meantime. So if you're bringing your brain back online from erectile dysfunction, then what needs to happen is practice, practice, practice. But when I work with people, I use professional neurofeedback coaching and brain training to pull their brain quickly back through exercise, through brain training, back to the green zone optimal functioning. So unfortunately, I'm jumping back up to number 1, but they're all number 1, like I told you. So when we work together through professional neurofeedback, I have all the data. Remember, it's all measurable. I can see what your brain is doing, and I can see your brain improving. As your brain performance pattern improves and you practice healthy sexuality and getting aroused at level 8 to 10, now your brain will start hardwiring in the new neural pathways for healthy arousal. And again, you have to stay out of those unhealthy old neural pathways of level 15 arousal. And this is what's going to get you there. So let's put a bow on this before we wrap it up, okay? Number one is that at the core of erectile dysfunction, whether it be psychological or physical, is a brain that is dysregulated. It's using the pendulum effect brain pattern, and it's flooded with dopamine, not allowing healthy arousal to happen in a way that it should. So the solution for that, I'm sorry to tell you, the only solution is to train your brain. So the best solution is to get into an assessment with me so that I can show you what's happening in your brain, and we can make a plan together to bring your brain back online for healthy erections, healthy sexuality, and an amazing life. An amazing sex life too, because we'll cover that in coaching. So get an assessment. Go over to drtrishleigh.com. Get your brain assessed by somebody who knows what to look for. And unfortunately, there's really not many, there's nobody I know who knows what to look for that I know what to look for. So get into that assessment so that I can help you. If you can't afford an assessment, and I get that, the next solution is to order the brain training headband that's on my website. I will put the link below. And that brain training headband, if you use it by yourself, it's going to be a start. It's a great start. So get going. Save your money if you don't have the money for it. You purchase it through that link, but you purchase it directly from the manufacturer. And because I'm one of the top ambassadors in the world that tells people to use this awesome piece of technology, you get it at the lowest price you can possibly get it through my link, the one on my website. You'll pay more if you use a different link. So get that link off my website and get that headband. And if you ever choose to work with me, I have a professional provider platform that I can see all of your brain training graphs. So get that headband, and if we work together ever, I can go back and look at what your brain was doing, what it's doing, and I can help you out even with that headband by itself. So number one, top tier level, you want to fix this thing, get into an assessment with me. Number two, get the headband, start training your brain at a lower level by yourself. Those are your two options for brain regulation, primary issue. Number two is nitric oxide and calcium. So you could have your body assessed, which is also something I can do in neurofeedback coaching with some of the people I partner with. We can have your body assessed for how that is flowing and see if there are some issues in your cellular response at the molecular level. That can be tested at using blood tests. But again, most people don't know what to look for. But you could use a supplement, but this comes with the warning that this is for education, and I'm not endorsing anything outside of my program because I'm just not sure about things that are out there besides what I use. And I'm still working on the back end of that with the people that I'm working with. So when you get into the assessment, I can give you that recommendation because I'm trying to keep it a little bit closer to the chest right now until I'm ready to be an ambassador for that company. Then number three is arousal. Stay out of porn, stay out of fantasy, avert your eyes during lusting, get your eyes back on your honey, and talk with your honey about your sex life and what you can do to spice it up. Here's one more solution is think about what you find to be the most arousing sexual act. Likely it's unhealthy, but if there's a way you can switch it to be healthier and to do it with your honey, then this can make it so that you'll have the most arousing thing going during the sexual experience with your partner, which will help this tertiary level of dysfunction. Okay, I hope this helps you out. It's a little bit longer one, but I know it's an important topic. This is a brain problem, my friend. So brain problems need brain solutions. So please reach out to me, get the assessment, and let's get this party started so I can help you heal. Okay, so until next time, please remember, control your brain or it'll control you. I'll see you then.